The Papua New Guinea Health Service has a windfall of government funding, but it also has a shortfall of the service reaching those in the rural parts of the country. Goroka MP Bire Kimisopa led a team to provinces around the country to find out exactly what was stopping the service from reaching the people.
Whether there's any truth and honesty in the way we frame the budget. And if in fact the appropriations are right. And we're persisting with an accounting system, cash basis, that we allow our senior bureaucrats to spend money like crazy.
The findings show that even with free primary health, sick people away from the country's main centers are not getting enough of the service. Much of the shortfalls have been attributed to where money is being spent, who is spending the money, and how it is being accounted for. The Special Parliamentary Committee on Reform and Service Delivery have found that the more hands the funds go through, including the provincial governments, priorities change and the money is spent elsewhere instead of the health service.
In the fiscal regime that we have in the country, we don't allow for contingency that we pick it up in the next fiscal year, so that the commitments Parliament makes to its people must be kept, must be honored. That's legal, that's binding. Otherwise, it would appear to me that's contempt of Parliament, that we're not living up to the expectations of the budget.
The committee also found irregularities in the procurement of drugs. 60 to 70% of drugs aren't needed, and those needed are always in short supply after purchase. The drug supply procurement irregularities show a level of corruption at hospitals and healthcare centers. Recommendations will be made after a public inquiry that will involve the general public and stakeholders in Port Moresby. But the chairman has hinted from his personal view that a structural change needs to happen in the public service to ensure that Cabinet's promise to deliver health services is met. Bethany Harriman, National EMTV News, Lae.